what happens, we can use the erythrocyte osmotic fragility of the erythrocytes. So that osmotic fragility of the erythrocytes always helps us to identify the different disorders in the red blood cells. And the next is erythrocyte sedimentation rate. So the next aspect which we can see in the hematology is erythrocyte sedimentation rate. So in the erythrocyte sedimentation rate, you can see how much of what we can say like red blood cells were sedimented in the meter. Okay, so this we are going to see. But anyhow, we can see the erythrocyte sedimentation rate is a non-specific measurement used to detect and monitor an inflammatory responses to tissue injury. That means we know inflammatory response, we already know. So like uh, what we can say, like it should be bulged. So the tissue should be bulged, or like you can see some wound, that inflammation we can see. So in inflammatory response, to detect it, so we go for erythrocyte sedimentation rate. So the erythrocyte sedimentation rate can help us to find the uh, inflammatory responses, and in which there is a change in the plasma concentration of several proteins. So why it is, because when the inflammatory changes happens, and you can see that there is a large number of proteins were changed from the cell, or you can say that from the serum. So the serum will have a differences. What I can say, when there is some kind of disorder is suffering by, then automatically what happens, you can see we go for blood testing and all, and there you can see like increase in creatinine levels and urea levels, or like sugar levels or something like that. So what does it mean? So all these will help us to say that there is some discomfort in the body, or you can say that the body condition is not good, right? So some kind of damage is happening in the tissues. The same way, what happens, the erythrocyte sedimentation rate can also help us to determine the acute phase proteins. When we identify the acute phase proteins, then automatically you can say that the person is suffering with the different kind of what we can say like inflammation or any other thing, right? So here you can see that there is a change in the concentration of several proteins, which including the acute phase proteins can be seen. That means they will be appear only in that particular condition, so that we can see. Then this procedure very simply consists of allowing a specific amount of blood to sit on a vertical position for a period of time. So we are just allowing, like in the previous slide you will see, we are just allowing the blood to sit on a vertical position. So when it sits here, you see it is getting sedimented. So when it gets sediment, then automatically you can say that is its value, like this one, right? Okay, so this value always helps us to find the erythrocyte sedimentation rate. So this procedure very simple. So it consists of allowing a specific amount of blood to sit in a vertical position for a period of time. So we are just keeping it in a vertical position for a period of time, and we are allowing the cells to settle down. And the distance in milliliters that the red cells fall during this time period is the erythrocyte sedimentation rate, and is reported in millimeter per hour. So do you understand? It's so easy. It's very easy to understand. What you have to do is you just collect the blood, and then the collected blood will be placed in the tube, and that will be placed in a vertical manner. That means, so we are keeping it in a stand, then we'll keep it for some time. Then automatically what happens, the red blood cells will get settled down. That means they will get sediment. Then the remaining serum you can see. And when we place this tube at a scale, and there you can calculate it in milliliters, So the distance in milliliters can be measured, that the red blood cells fall during this time period, and that one will be used to report the erythrocyte sedimentation rate as millimeters per hour. So erythrocyte sedimentation is affected by three factors. You can see the three factors are like erythrocytes, so the number of erythrocytes can influence it, plasma composition, so if the plasma composition is different, and then again what happens, the erythrocyte sedimentation rate will also be varied, and then mechanical or technical factors. So the mechanical and technical factors are like, when we place the tube on a specific place, and then when it is like, shaken, then automatically what happens, you can see there is a different kind of, what we can say, uh, we can see a different kind of disturbance in the solution, which leads to the disturbance of the packed cells, or like, sedimented cells. So in that case what happens, we can see there is a that is the factor which also influences the erythrocyte sedimentation rate. Okay. Okay, so what are erythrocytes? We already know that erythrocytes are the factors of chief importance in determining the distance of RBC falls in the size or mass of the of falling particles. The larger the particle, the faster its rate is. And in normal blood, the red blood cells remains more or less separated. They are negatively charged and therefore repel each other. So red blood cells remain more or less separated because they are negatively charged. So that's why they will be repel one to other. So when they repel one to other, then what happens? They will be separated inside. That's why you can't see that the red blood cells are attached one to other. So you can see the cells which are attached in one to other in the bloodstream are platelets. Only the platelets will form as like they can form as a layers, that we call it as like rowlet. Rowlet we can call it as, right? But whereas in the red blood cells it is not. Okay, so that's what we can see. Then in certain diseases, a plasma protein concentration may be altered, so that means you can see that there is a change in the plasma protein concentration, and then causing the reduction in the negative charges of the red blood cells. So when there is a change in the plasma proteins, then it reduces the negative charges. So when the negative charges of the red blood cells are getting reduced, and then automatically, so they will form as like a consequent formation of Rolex. Rolex is like formation of like layers. మనం తెలుగులో అయితే దొంతర్లు అంటాం కదా. సో లైక్ వైజ్ వాట్ హ్యాపెన్స్, యూ కెన్ సీ ద రౌలెక్స్ విల్ ఫార్మ్, right? So the Rolex is always because of the change in the, or like reduction in the negative charges, okay, of RBC, and this leads to the large mass and an increased sedimentation velocity. So which leads to the high amount of sedimentation velocity. So what does it mean? When the red blood cells are not in the normal stage and they are getting affected, then automatically their negative charges will be get reduced. When their negative charges are reduced, then automatically they'll form as a Rolex, and when the Rolex forms, and then it leads to the large mass and an increase in the sedimentation velocity. When the sedimentation velocity increases, then the sedimentation coefficient also will be increased, or you can say the rate of erythrocyte sedimentation can also be increased. Okay, do you understand this? Are you clear? Is it clear, ma? Is nobody in the class?
Yes, sir.
Ma 17, 19, 22 వచ్చినారు ఆల్రెడీ.
17 present, sir.
17 present. Then who is this 27? 27, 25, 22, 19. ఇంకా నలుగురు రావాలి ఇక్కడ క్లాస్లో. Call them, ask them to join in the class. Okay, so what will happen here? So when there is a change in the condition of a person, and then automatically what happens, the plasma protein concentration will be changed, and when the alteration in the plasma protein, then automatically it causes reduction in the negative charges of the red blood cells, which leads to the formation of what we can say like attachment of red blood cells and formation of rowlets. So this will increases the sedimentation rate in the what we can say in the blood. So then agglutination of red blood cells is due to agglutination of red blood cells is due to change in the erythrocyte surface, also leads to an increased red blood cell mass and more rapid sedimentation. So agglutination of red blood cells, that means when they join one to other due to changes in the erythrocyte surface. So that erythrocyte surface, how it is changing, so you can see there is a change in the negative reduction in the negative charge. So when there is a change on the membrane, then automatically it leads to the increased RBC mass and more rapid sedimentation rate. So that's why you can clearly say from this slide stating that the people who are suffering, the people who are already infected, the people who are having some defect, some inflammation, some other things. So they have like there is an alteration of plasma proteins, or the plasma protein concentration will change from this blood. When it is changed, then automatically you can say the change in the plasma protein leads to the reduction in the erythrocyte membrane charges, and negative charges will reduce. So erythrocytes will sediment. What does it mean? That means if there is some problem inside the body which leads to the change in the erythrocyte negative charges, or like reduction in the negative charges of the erythrocytes, which leads to the increase in the erythrocyte sedimentation rate. So if there is an increase in the erythrocyte sedimentation rate, which indicates the worstness of the body, that means the situation of the body is becoming worst when the uh, sedimentation rate get increases. Are you clear with this? So when the sedimentation rate increase, then the body condition is or what we can say like deteriorated, right? So that means the person is suffering with the disease. Is that I muted? Okay. Okay, so it ran into a problem and then it disconnected and I came back. Okay, so remember, when the erythrocyte sedimentation rate increases, then it indicates that the condition in the body is more complex. That means more worst. Okay, so the more pathogenic, or like it is becoming worse and worse. So that's why the erythrocyte sedimentation rate is always to be calculated, right? And then the next one. So the macrocytes tend to settle more rapidly than microcytes. RBCs show an alteration in shape, such as like sickle cell, and then spirocytes are unable to aggregate or form rowlets and the sedimentation rate is decreased. So you can see like macrocytes or like microcytes, so they are able to sediment. But when the red blood cells are not in the normal form, what do you say normal form in the sense? I already discussed in the earlier class. So when the shape, or you can say like in the osmotic fragility happen, then the cell shape will be changed. Okay, so spherical forms or spirochetes or like sickle cells. So these will not get aggregate. So that's why you cannot see that any in that condition you can see there is a reduction in the sedimentation. Then anisocytosis is anisocytosis, it is called anisocytosis, and poikilocytosis reduces the ability of red blood cells to form large aggregates and thereby tend to falsely lower ESR. So the falsely lower ESR in the sense we'll get the wrong results. So especially anisocytosis and poikilocytosis are the two diseases where we can see the reduce in the ability of the red blood cells. Though it is a diseased condition, but you can see that the aggregations will be get reduced. So it gives a false results, but the person is suffering with this particular disease. Then in severe anemia, the ESR is markedly elevated, and the concentration of red blood cells is decreased, and aggregation and the Rolex formation are increased, and therefore settle out more easily and rapidly. So that is in severe erythrocyte, severe anemia. That means the red blood cells are less, right? Then the ESR is markedly elevated. The concentration of red blood cells is decreased. So aggregation and the Rolex formation are increased. And what does it mean? Concentration of red blood cells are decreased in the sense, so they were already formed as Rolex and they were under degradation. So they are not available for oxygen carrying from the lungs to the tissues, or like carbon dioxide carrying from the tissues to the lungs. Okay, so that's why it doesn't form, it forms Rolex and it shows more sedimentation, but you can see it is a severe anemia. Severe anemia always says a less number of erythrocytes. Though it is less number of erythrocytes, but you can see that there is a decrease in the increase in the erythrocyte sedimentation because of the Rowlex formation of these red blood cells that we can see. And in polycythemia, in which the red blood cells count is high and the erythrocyte ESR generally normal. So in polycythemia, in which the red blood cells count is high. So polycythemia lo count is high always, but you can see that they are generally erythrocyte sedimentation rate is very less. So though there is a more number of red blood cells. And I already told you that the plasma composition can also influence it, right? What influence we can see in the plasma concentration then. So the plasma composition is the most important factor, which I already discussed in the first slide, right? There, what will happen? You see, Rowlex and aggregation of RBC are controlled primarily by the sorry acute levels of acute phase proteins. Most they are like alpha globulin, alpha 2 globulin, alpha 1 globulin, and these increasing these three plasma protein levels or increases the plasma increased in the plasma. So that means in the fibrinogen, alpha globulin 1 and then alpha globulin 2, these are the three protein molecules which are essentially present in the plasma. Okay, so the Rowlex and aggregation of the RBC are controlled by these three proteins. So what will happen? Increasing these three plasma proteins or increases the plasma, increased in the plasma. Okay, increasing these So that means increasing in the sense like acute phase proteins can be increases these three proteins. As the concentration of protein increases, so does the viscosity of the plasma will also increase. Although an increased plasma viscosity will tend to inhibit the fall of the red blood cells, the increase in plasma proteins are also generally those which causes Rowlex and aggregation of the red blood cells, which affect the erythrocyte sedimentation rate and greatly than does the increase the plasma viscosity. So the increasing concentration of albumin will tend to lower the ESR. So increased plasma viscosity usually inhibits the fall of RBC. So when RBC is fall, then automatically erythrocyte sedimentation rate will be low, right? So the increase in this like fibrinogen, globulins, uh, molecules can always decreases the erythrocyte sedimentation rate because they intendedly or like they are directly reduces the red blood cell concentration or inhibits the fall of the red blood cells. So that's why you can see the low levels of erythrocyte sedimentation. What are the technical factors or mechanical factors which influences? It is important that the erythrocyte sedimentation rate tube be exactly perpendicular. A tilt of 30 can cause errors up to 30%. A tilt of 30. So 30 times can be tilt chesarankondi, so you may get wrong results. Also, the rack holding the tubes should not be subject to any movement or vibration. So it should be stand. That means it should be stand. So it should not be moved. And minor everyday variations you can also see. So minor everyday variations in the sense if you collect a blood today and go for like erythrocyte sedimentation, you may get one value, and if you go tomorrow and you'll get another value, and day after tomorrow you'll have another value. So these values are minor values, minor changes. Okay, and with a large changes in temperature, however, the sedimentation rate increases as the temperature increases. So when the temperature increases, automatically sedimentation rate can also be increased. That's what we can see. And the length and inner diameter of the erythrocyte sedimentation rate tube also affect the final test results. The length and inner diameter tube of the, that means because when there is a large inner diameter, then automatically what happens? You can see that the number of cells which are sedimented will also be get down because the area is high, diameter is high. When it is a normal, and then you can see a normal cells are always influences the, so that also you have to look. So that means erythrocyte sedimentation rate tube diameter and its height and all everything also matters. Okay, that's what we can see. The normal values of erythrocyte sedimentation rate for the human adult males is about like 0 to 15 millimeters. I already told you the increased erythrocyte sedimentation rate always shows that you are in trouble. You are suffering with something. You are suffering with some disease or condition in your body is not good. You are exposed to the inflammation or anything else. So that indicates. So the low levels of R, like a normal levels of erythrocyte sedimentation rate values are, in case of adults, it is like 0 to 15 millimeters. And whereas in case of females, it is 0 to 20 millimeters per hour. Because in female, you know that the red blood cell loss is more. So that's why there you can see the high amount of uh, erythrocyte sedimentation rate. What is the significance of erythrocyte sedimentation rate then? The ESR represents the non-specific responses to tissue damage, inflammation, and also denotes the presence of disease, but not its severity. Because a severity in the sense, it doesn't say that what severity it is, but you can say the severity maybe you can say in terms of like when the erythrocyte sedimentation rate get increases. That means say today, like today some erythrocyte sedimentation rate, and afterwards after few days, and then again you can see there is another sedimentation rate. So in that case, what happens if increasing, then automatically the increasing erythrocyte sedimentation rate may also increases the possibility of to say the severity of the disease, right? That's what we can see. So then, so the severity may not be easily identified, but you can see that it denotes the either a non-specific response of the cells or like non-specific response. Not knowingly, we are exposed to something, and then the tissue can be damaged, and then inflammation you can identify, and also the presence of disease can also be identified. Okay, so it primarily reflects changes in plasma proteins that accompany most that acute and chronic infections. So changes in plasma proteins is always an important aspect in case of erythrocyte sedimentation rate. So what will happen here? So usually the erythrocyte sedimentation rate can increase or decrease the damage of red blood cells. When the red blood cells are damaged, then automatically it is a diseased condition where we can see anemia. So because of anemia, what happens? The what we can say that red blood cells and then white blood cells are having antibodies, immunogens, and all. So when the immunity get reduces, then automatically the non-immune molecules or like immunosuppressor molecules will be get increased in the plasma. So there is a change in the plasma protein concentration and change in the proteins release, and that is ultimately indicates this erythrocyte sedimentation rate. Okay, so it indicates that the chronic inflammations are like tumors, acute or chronic inflammations, and degenerative diseases, and so on. So many things can be characterized here, and it may be used to follow the progress of certain diseases such as tuberculosis and rheumatoid arthritis. So the rheumatoid arthritis or tuberculosis are the two things which we can see it progresses. So it also increases certain diseases. Okay, so that you can see erythrocyte sedimentation rate we can see. So usually the elevated erythrocyte sedimentation rate may be found in during pregnancy, you can see after the third month usually. Then acute and chronic infections. So acute and the dangerous infections. Chronic in the sense, so they are lethal. So the person will die. Okay, and rheumatic fever, rheumatoid arthritis, so myocardial infections, nephrosis, acute hepatitis, menstruation, tuberculosis, hyperthyroidism, hypothyroidism, and so on. So there are different conditions where we can see the elevated erythrocyte sedimentation rate that you can see. Then about like adults who are like 60 years of age frequently have a slightly higher ESR value due to the primarily the decreased concentrations of plasma albumin. So when the plasma albumin will get decreased, then automatically what will happen? So the amount of red blood cells will get increased. When they get increased, and then erythrocyte sedimentation rate will also get increase. Okay, and a decrease in ESR will also be observed in the situations like polycythemia, I already told you, then cognitive heart failure. So when the heart failures happen, cognitive heart failures, and there you can see, then hypofibrogenemia, fibrino, fibrino, fibrinogenemia. So this fibrinogenemia, like it reduces the amount of fibers. So the fibers are responsible for, or like they are nothing but the what we can say the elongated protein molecules present in the muscles. That we can see the damage in the muscle, and the presence of red blood cell abnormalities, like red blood cell abnormalities like poikilocytosis, spherocytosis, and sickle cell anemia, and so on, can also decreases the erythrocyte sedimentation rate. So that means you should not say that when there is a decreased erythrocyte sedimentation rate, it may be good for health. No. So if it is 0 to 15 or 0 to 20, then it is good. If it is more than that or like less than that, that is a diseased condition which we can see. Who is number 20? Okay, so there are so many methods to identify this, but the simplest method is like taking the blood into the uh, erythrocyte tube and then placing it for some time, to settle down the erythrocytes, so that you can see the erythrocyte sedimentation by placing the tube on the erythrocyte sedimentation meter. So where you can calculate what is the amount of sedimentation happened by the erythrocytes. But you can also see the another method that is called as Westergren method. So the reagents and equipment here, it is like it requires uh, estrogen pipette collaborative with the milliliters that you can see, and you can also see uh, like the National Committee for Clinical Laboratory Standards has set specific dimensions for the pipettes to be used. So the length is always 300.5 millimeters. It may be plus or minus 0.5 millimeters. So standard, it should be fit into the standard. Then external diameter. So the external diameter, it should be always 5.5 millimeters. So it can be like 0.5 millimeters is the flexibility you can have. And the internal bore, usually it should have like 2.65 millimeters, and which may be having like 0.15 millimeters variation is allowed. Then the graduated scale on pipette. So it's always like, a pipette itself is having the graduated scale. So 200 millimeters plus or minus 0.035 millimeters, and graduated lines of uniform thickness, which is like 0.2 millimeters, will be coated on the tube. Then three Westergen pipette racks we have to take. All racks should contain a leveling bulb. All racks should contain a leveling bulb in order to ensure that the position of tubes is vertically arranged. So you have to see that they are the vertically arranged. Then reagents and equipment are Westergen rack. So you see the Westergen rack is this one, right? And then disposable pipettes, you can have like disposable pipettes here, and then uh, leveling plate for holding the Westergen rack. So leveling plate you need, this is the leveling plate, and then timer, you need timer, so how long it is taking. Then specimens are like whole blood diluted with the 0.109 m trisodium citrate. It's one volume only. So that means if you take 5 ml blood, you have to add 5 ml of 0.109 m trisodium citrate. Alternatively, 3 ml whole blood anticoagulated with the EDTA. So you can add either trisodium citrate or EDTA as an anticoagulant. And if this specimen type is used, the whole blood 2 ml, you can say, must be diluted with 0.5% sodium chloride. So prior to the testing. So that means it has to be diluted with. So when it is highly concentrated. And the principle involved in this is whole blood anticoagulated with 0.109 m trisodium citrate or EDTA anticoagulated blood 4 volumes and diluted with 0.85 sodium chloride is mixed and placed in a western grain pipette, and then the number of milliliters the red blood cells fall during this timed period is constituted the ESR. So the whole blood, we take whole blood, which is anticoagulated, that means which is already added with the trisodium citrate or EDTA, and then we take this as a 4 volumes. 4 volumes in the sense we take like, for example, if you go for like 4 ml, if you go for like 0.5 ml, so the 4 volumes in the sense 2 ml, right? That way I have to take. Then it is diluted with the 85% sodium chloride. So it's 1 volume. That means 1 volume in the sense. So if it is already 5 ml or 10 ml or 2 ml, you can say. So then automatically we will also add 2 ml of 0.5% for 85% sodium chloride. Okay, then we'll mix it and we place the mixer tubes into the Westergen pipette, and then allowed to stand for exactly 1 hour. So in a vertical position, we'll keep it. Okay, so the blood cells fall during this period of incubation, and then they constitute the erythrocyte sedimentation rate. The normal value for the modification of Western ESR are 0 to 15 millimeters per hour in case of women, and in case of men it is like 0.0 0.10 to 10 millimeters per hour, and whereas in children it is like 0 to 10 millimeters per hour. So it is erythrocyte sedimentation rate only for like Western type. So mix the diluted blood for at least 2 minutes. That means you have to add that sodium citrate and then sodium acetate and all, and then you have to mix it 2 minutes or rotate, and the blood should be at temperature, at room temperature. So when it is in the room temperature, nothing will happen. Then check the tubes for clots using two application tricks, two applicators sticks. Make certain the Westergen ESR rack is exactly level, and then fill the Westergen pipette to exactly the 0 mark, and making certain there are no air bubbles in the blood. So you should see that there is no air bubbles in the blood. That is most important. And you allow the pipette to stand for exactly 60 minutes, and then allow the at the end of the 60 minutes, you just record the number of milliliters of red blood cells have fallen, and this results is the erythrocyte sedimentation rate in the milliliters per hour. That's what we can see. And there is another method called as like Landsberg method. So it requires like Winthrop tube calibrated in milliliters, Winthrop tube, and then Winthrop pipette rack and disposable capacity pipette, then applicator sticks. Okay, so we use whole blood as a specimen. Usually we need only 1 ml. Using EDTA as the anticoagulant, you can add it. The principle behind this method is like it's a well mixed whole blood is placed in Winthrop tube and allowed to stand for 1 hour. The number of milliliters the red blood cells fall during this constitutes the ESM. In the Winthrop, the lands Landsberg method, the normal values for the women are like 0 to 20 millimeters per hour, and for men it is like 0 to 9 millimeters per hour. Okay, so then mix the whole blood for at least 2 minutes on a rotator. Make certain the blood is at room temperature. Check the tubes for clots using two applicator sticks. And then with the capillary pipette, fill the ventrope tube to the mark up to 0. Then place the tube in an exactly vertical position in the rack. So the time is almost 60 minutes for completion of this experiment. Then at the end of 60 minutes, record the level of the erythrocyte count. Just record so many are there, and this results is the erythrocyte sedimentation rate in the milliliters per hour. That's especially in this method. And if we discuss, the sedimentation of red blood cells takes place in 3 stages. In the first stage, in first 10 minutes, Rolex formation occurs and the sedimentation rate is slight. So you can see that a low amount of sedimentation. Then the sedimentation then occurs for a period of approximately 40 minutes at a more rapid and more constant rate. So that we can call it as like a decantation can also be done here, right? So that's what we have discussed. Then during the last minutes, the sedimentation rate is slow because of the accumulation of RBC. So during the last 10 minutes, you can see that the sedimentation rate is slow because of the accumulation of RBC in the bottom of the surface. Then the longer the tube and the longer is the stage, uh, 2 will last and other the higher the ESR results. And there is a call must be taken, care must be taken against the people who are suffering with the uh, this erythrocyte segmentation rate. That means with the different diseases that you have to uh, revolutionize or like use this for ESR segmentation rate can be used to identify the what we can say like diseased condition. So the occasionally the upper level of the blood may be only reached to the 1 or 2 millimeters mark. And then in such cases, care should be taken when making the final reading, subtrate the 1 or 2 millimeters from the final results. And we can also see that they can be added into the reading value, and then we can know the erythrocyte sedimentation rate. So usually it is like it falls like 18 millimeters per mark or like 16 millimeters per hour. This is what we can see the erythrocyte sedimentation rate. Then all the sedimentation tracks should be equipped with leveling screws and a spirit level. So it has to be very good uh, equipment that should be leveled. It should be leveled. So mechanical sources are like, there are so many mechanical sources like bubbles can generate or like a decrease or increase in the room temperature can also influences, and the title of ESR tube increases the tilting. So when it is increased, then also you can see there is an alteration, and fibrin clots. So the fibrin clots can also important and they are outside, but you have to be very careful that you have to choose the persons like old age persons, and then you have to test that we can know with the erythrocyte sedimentation rate. And this ESR should also be set up within 2 hours of blood collection. And if the UGTA is used as the anticoagulant, the test may be set up within 6 hours if the blood has been refrigerated. So within 6 hours, we have to do this experiment. When we use the EDT. Then Weintraub ESR technique is thought to be more sensitive when the ESR is low, whereas the Westergren disorder when the Westergren procedure may more accurately reflects the patient's disorder when the results are high. The Westergren method has also been chosen as the standard method for the International Committee for the Standardization of Hematology. So when the reading of the ESR results on bloods with an extremely high WBC or platelet count, the Buffy code should be excluded from the reading. So you have to be very careful that there are some cells which we can see they can also get settled down, but you should not uh, count them. That's the most important aspect. If there is poor separation of the RBC and plasma, and this may be due to an increased number of reticulocytes and has been termed stratified sedimentation. It can be called as stratified sedimentation. So the most internal bore and the length of the graduated scale on the Westergen pipettes are critical measures. So we cannot easily count them. So that's why it is a critical one. You can also use like a disposable ESR. So there are commercial kits available for testing the ESR, and you can also test it. So that's not an issue, but you can get it. Okay, so this is what I want to tell you as erythrocyte sedimentation rate. Okay, so if you remember in the last class, I told you in the last week, I told you have to complete the blood grouping, right? Blood grouping with the WHO, what we can say like marked color method. ఎవరు చేశారు? Who is done it? Fatima Taslim.
సార్ చేశాను సార్.
Okay, so what is your hemoglobin then?
సార్ ఇట్స్ ఇన్ బిట్వీన్ 8 and 10 సార్. ఐ థింక్ ఇట్స్
In between 8 and 10.
ఎస్ సార్.
Okay, so is it clearly observing? Are you clearly observed that?
ఎస్ సార్.
Okay. So is anyone? Others? Do you have class now? క్లాస్ ఉందా మీకు?
ఇంకా లింక్ పెట్టలేదు సార్.
పెట్టలేదు. సరే ఓకే. ఇంకెవరు చేయలేదా? ఏంటి వెంకటేష్? వెంకటేష్ నేను క్వశ్చన్ అడుగుతాననేసరికి వెళ్ళిపోతున్నారు చల్లగా. ఓకే, సో ఇఫ్ యు ఆర్ నాట్ ఏబుల్ టు ఆన్సర్ ఇట్ అట్లీస్ట్ రేపటికన్నా చేయండి. ఏం ఒక నీడిలే కదా కావాల్సింది. ఏమా ఫాతిమా, ఇస్ ఇట్ నాట్?
ఎస్ సార్.
Do it. So I want your results tomorrow. Okay. ఏం చేస్తున్నారా ఎంత? ఏంటి ఎవరు మాట్లాడరు? మిమ్మల్ని ఏం అడిగేది?
సార్
ఏంటి ఎవరు ఏం మాట్లాడలేదండి? మీతో మాకేం పని సార్ అంటారా? ఉమ్, ఓకే. Then if you don't have anything to say, then I'm going to leave the class and end the meeting.